We are here at the Prime Health Summit. I am fortunate to be with the CEO, Steve Adams of Prime Health. How are you?
Terrific.
It's great to be here.
Pretty buzzed up, frankly. There's a lot of energy in this facility right now.
It's booming.
It is.
Well, thank you for inviting Startup Health here.
Thanks for being here.
It's great to be here. I thought we'd start out about the mission of Prime Health.
Sure.
And what it's all about.
Two high-level missions. One is to make Colorado the healthiest state in the union by 2020, and the second is to make it be the most innovative healthcare technology ecosystem in the country. And we think we're well on the way to that, as well as the first. So those are lofty goals, BHAGs some might call them, but we see all the pieces coming together that we can actually get there.
We call them health moonshots, and
there you go.
Extraordinary. So why Colorado? Why is it such a great place for entrepreneurs, for innovators, for health transformers?
Several things. One is that Colorado just seems to be more open and collaborative than a lot of states. It's easier to bring a company in here or start one here and get help. Join hands with other entrepreneurs instead of it just being the competitive mindset. There seems to be more openness in helping each other. And we've heard that a lot from people that are visiting the state and saying we might think we want to bring our company here, and they're kind of blown away by how much opportunity there is to work and learn with other companies instead of it just being a strictly competitive environment.
I loved how you focused on health as opposed to health care. It seems like health is a big part of the culture here.
It is. It's an outdoor kind of community. There's a lot of activity. We've bounced around rankings as one of the healthiest states in the country. And if you live here and you get up in the mountains, it's hard not to partake in that frequently. So I think that's part of it. And another part of it is that people just seem to be more engaged in their health. And I think Colorado might be an early trend for the rest of the country to say, I actually want to know more about my health. And bending away from kind of the patriarchal physician model and getting people truly involved and taking some responsibility for their health. That kind of awareness is just growing at an incredible pace in Colorado.
You're a serial entrepreneur.
I am.
You've built multiple companies. What are some of your biggest lessons learned, wisdom that you'd pass off to other entrepreneurs and innovators? One
is a fundamental that if you're an entrepreneur and you don't believe in this, I'd try another line of business, and that is tenacity. Nothing ever works the way you think it's going to work. No budget ever plays out in the kind of time frame you had planned on. No technology works flawlessly at the first time. So it takes tenacity and that willingness to really throw yourself at a problem that at first may seem Sisyphean, right? The boulder keeps rolling back on you, but with tenacity you can really make things happen. That's a common element for any entrepreneur, I'd say.
If you could wave a magic wand and sort of activate the army, global army of entrepreneurs, health transformers to solve one big challenge here that would help Prime Health get closer to its mission of making Colorado the healthiest state in the union, what would that change be? What would you love to see change?
In this healthcare system, what's our number now? 3.6 trillion? Going to 7 or whatever.
Right.
There is a lot of organizations making a lot of money in healthcare. And that causes some inertia, and it causes competitive silos. So if I could wave my wand, I'd say all of these big companies, small companies, startups, and everything in between, let's take a breath and see how we can join hands and work together to solve some of these problems. Many times there's these silos where, people show up at events and say, we want to collaborate and work with others, and then they go back to headquarters and say they're competitors, we're never going to do that. So I think there needs to be some rethinking in small and large organizations and enterprises, and I'm including the whole healthcare ecosystem here, from payers, provider organizations, everybody. We've got to look at ways to connect not just through technology, but through humans on ways to improve healthcare. And we have so much money embedded in the friction of competition that if we can, and I don't want to get in trouble with the FTC here, but there are ways to have healthy competition, right? And figure out ways, think of a healthy handoff, somebody getting discharged from one hospital into another facility that may not be theirs. If they work at exchanging that human information, that's going to make a difference at that new facility. You're giving better care, you're driving down the cost of care. So there's opportunities for healthy competition. If I could wave a wand in Colorado, everybody would get really smart about how to better work together to solve some of these thorny problems.
Predictions. What does the ecosystem look like here over the next 5 years from now?
I think it's just going to continue to grow and become more and more vibrant. It's the amount of energy that we're seeing. I just got named as CEO April 15th, and
congratulations.
Thank you, thank you. I'm really honored. But I was blown away by the number of people that reached out to me and said, "I want to be part of this. I want to help. When can we get together?" And so I just see that energy increasing and more opportunity for people to find where they, as an individual, can help improve healthcare. And that's, at the heart, that's what Prime is about. And so 5 years from now, I see this being an organization that has many thousands of participants in it, and maybe we're beginning to take that and cookie cutter it in helping other states to develop that kind of ecosystem, particularly in partnership with organizations like Startup Health that is rocking the world. Working together to expand that reach, do more work, and get better outcomes. There's so much opportunity for that kind of collaboration.
Well, it's an honor to collaborate with you, and thank you for being so welcoming to us as
we're excited about
we're establishing here. It's really fantastic. Last question, what do you do personally to stay healthy?
I sweat. Every morning, 30 to 40 minutes, like it or not. I'm either, doing sprint intervals. I know I don't like it. I have this love-hate with food, but I have to have the exercise because that is all about my energy. So interval training, ellipticals, and strength training. I do quite a bit of weight training. And without those, my attitude goes south. I have to have that lifeline to some very vigorous activity.
Well, thank you for everything. It's a great state, great community, great ecosystem, and thanks for all the great work you and Prime Health are doing.
We're so happy that you and your organization are here.
Excellent.
Great opportunities to work together.
Thank you very much.
Thank you.